Hi guys, my name is Dr. Alexandra Kopelovich. I'm a physical therapist here at Dr. Health Physical Therapy. I'm an orthopedic specialist as well as manual therapist. So the topic for today's Tuesday night tips is, drumroll, shoulder impingement. So a lot of you probably heard of shoulder impingement. It's a very common issue. I see a lot of patients at the clinic with that. So today we're going to talk about why it happens and who does it happen to and what to do when it happens to you. Okay, so we're going to start with basic anatomy, and we're going to talk about what shoulder impingement is. So follow me. We're just going to take a look at this anatomy poster. Come through. Okay, so here's your shoulder. Your shoulder is composed of three bones, basically. It's the humerus, it's the long bone right here, as you can see. It's your scapula, your shoulder blade, and it's your clavicle right here in the front. That's your collarbone. So what happens with the shoulder impingement is that you also have some muscles on top of the scapula, on top of the shoulder blade. That is your rotator cuff. So the action of rotator cuff is to actually stabilize the humerus and attach it to the scapula once you're moving your arm up and down and to the side. It's basically to suction it in and to stabilize the head of the humerus. So what happens with impingement is that the rotator cuff is not working properly and the humerus here is being pinched. Do you see this little space right here that's created by this little bone and this little bone, acromion and coracoid? This little space is supported by coracoacromial ligament. So your humerus, as your arm moves up into shoulder flexion, keeps hitting the coracoacromial arch and essentially creating compression, creating inflammation, and thus pain. So now we're going to talk about who it usually happens to. So a lot of times it can happen to younger people and middle-aged people as well. So with younger people, it usually happens to athletes who require a lot of overhead activity. So things like tennis, baseball, so anything overhead that you can think of swimming. So that happens a lot. Whenever you have poor mechanical dysfunction of the shoulder, that can happen to athletes. In middle-aged population, it happens to possibly construction workers, people who paint a lot, people who draw a lot, max, so people with, once again, overhead activities. Also, we can't rule out people who are sitting at their desks and have this poor posture. And once you have this poor posture and you come out of it and trying to do some things at home, such as take something out of the cabinet, you are also susceptible to impingement symptoms. So that's the population that it usually happens to. So essentially, they identified, the research identified 3 stages of impingement. The first stage actually happens to younger people mostly, under 25 years old, and it's basically the inflammatory stage. It's the reversible stage where all you have is the inflammation in the shoulder, you have some pain. Usually people ignore that stage, but it's treatable with physical therapy. The second stage is fibrosis and tendonitis. It's already when you start getting some partial wear and tear of the tendons of the rotator cuff that we discussed earlier. And that's when you start getting more pain and actually histological and physiological changes in your shoulder are happening. So that is partially reversible by physical therapy. And finally, the last stage is bone spur and tendon ruptures, and that is unfortunately not reversible. Physical therapists cannot shave off your bone spurs, so you should not wait until that happens, and you should see a physical therapist with early signs of impingement. So since we started talking about the signs, let's discuss what does a physical therapist see in the clinic as a presentation of the shoulder impingement. So once you're going to come into the clinic, the physical therapist is going to do his objective evaluation. We're going to look at the range of motion, how the shoulder is moving in all different planes, all different directions. We're going to look at the muscle strengths because we're able to dissociate different muscles. We're going to look at the rotator cuff. We're going to look at the ratio between different muscles, so that's something we can assess for you. We're going to look at the joint mobility because with shoulder impingement, there are certain structures that are going to get a little tighter and certain structures that are probably have more laxity. So that's something we can assess for you. But subjectively, here are some things that you can look out for that you will feel with the shoulder impingement. So it's usually anterior or front of the shoulder pain that can start higher up and then distribute lower down as a radicular symptom pain. It can also spread a little bit behind your shoulder. It depends on the type of impingement and the structure being pinched specifically. The pain, there should be no numbness or tingling was the sign. Once again, like I said, it's mostly with reaching overhead activities. So if you feel any symptoms of that sort, you can come and see us and hopefully we can help you out. So for now, I'm going to show you some exercises that I do with my patients in the clinic for rotator cuff impingement. And hopefully you like them and you can do them at home. These are exercises that you can do as a home exercise program once you have the impingement, and you can certainly use the exercises as a preventative measure for impingement once again. So I'm gonna have Max help me out. So these are typical, he's gonna be laying down. So these are called jobs for exercises. Basically they're targeting rotator cuff. And once again, you obviously need, if you do have issues, you need to consult a professional medical personnel for help. But these are some exercises that can help you. Max, lie down on your side facing me. That can help you with preventative care. Okay, so he's going to be laying down on his side. Okay, so I suggest starting these exercises in the same pattern and in the same, you can bend your knees, in the same order as I'm gonna do them. So we're gonna start, I'm just gonna put something under his arm. So basically the first exercise is sideline external rotation, and the patient's gonna be on his side. Make sure there is something supporting the elbow right here. So the elbow is in neutral position. Not only it gives you a cue on how to properly move, but it also puts the muscles in a proper position and allows the muscle to function at its best. Okay, so what Max is gonna do, he's gonna move his arm up and down and make sure he's not feeling any anterior front shoulder pain, okay? And he's gonna start with about 3 repetitions of 15. So for our rotator cuff, we want to make sure that we develop endurance. So you want to go for more repetitions and until the muscle actually gets fatigued. So 3 sets of 15 would be a good number to start with. Obviously, it depends on the patient personally. Okay, so that's going to be your first exercise. Your second exercise, I'm going to have you lay down on your stomach. You're gonna slide off close to the edge of the bed, and what you're gonna do with your thumb up, okay? Make sure the thumb is up, that's very important. That rotates your humerus, the big long bone inside the socket, and it puts the tendons in the proper position once again, so there's gonna be no pinching. And what you're gonna do from this position, you're just gonna come back up and slowly lower down and come back up and slowly lower down. Once again, this is the exercise. It gets a little bit of the big deltoid muscle that we don't really want to work, but it also gets your rotator cuff as well. So we would like to start with 3 sets of 15 and progressively increase the number of repetitions and increase the number of sets. So we're gonna go into, this is called the extension type of motion. Once again, the main thing about this exercise is to make sure that your thumb is up. Okay, so the next exercise is gonna be right here. So the thumb is going to be up, pointing towards the ceiling again, and Max is just going to slowly lift the arm up and bring it down. So I just don't like this pillow right here, so I'm just going to move it out of the way. Thanks. Okay. So you want to make sure the patient does not fall off the bed. Number 1, safety. Okay, and you're just going to lift the arm up and slowly bring it down. Okay, and lift it up. And ideally, I would have his neck in a more neutral position, so I would prop him up with possibly a pillow or a towel under his forehead, so his neck is not straining one unilateral musculature, so one-sided musculature. So once again, thumb towards the ceiling, that creates better rotation of the humerus and prevents the impingement of the muscles. And lastly, our 4th exercise of Joby's exercises is going to be 90 degrees of abduction and external rotation. So this is the final exercise This is the most strenuous one for your rotator cuff, and Max is gonna go from neutral all the way up, and you can cue yourself or your patient into opening up your hand with your fingers a little bit more. So push your hand into my fingers, beautiful. And bring it down, push your hands into my finger, beautiful. Okay? And you're gonna be lifting it up. Once again, I would start with 3 sets of 15 and then slowly move your way up from there. I'm just gonna show you one more stretch, which is a great stretch for shoulder impingement. It essentially stretches the posterior capsule. Your shoulder, one thing I didn't discuss in our little anatomy section is the shoulder is surrounded by capsule, and it basically stabilizes everything around the joint. So essentially in shoulder impingement, the back part of your capsule starts getting tight, and that's another reason why you're getting the pinching. So this is a really good stretch for the capsule. Max, lie down on your side facing me and just put your arm right here. Beautiful. So I would give him a pillow. Okay. So we would start just like this, sideline, and you can take your arm and you can stretch it down, make sure there is no pain. Once again, you're kind of taking the arm into this internal rotation where you're more susceptible for impingement, so you have to be very careful with this exercise. If you start feeling any symptoms in the front of your shoulder, that's probably a bad sign. If you're feeling things behind your shoulder, that's a good sign, so you have to be aware of this. So you're gonna stretch your arm down, okay? And Max, where are you feeling it?
Back.
In the back of your shoulder. Okay, so Max is feeling the posterior capsule stretch, the capsule that we actually want to develop and stretch. Beautiful. So our goal is to go as close down to the table as possible, and the force direction which Max is applying right now is directly towards the table. So that's something we'll want to do. So essentially we would want to stretch for about 30 seconds at a time, and we do it 5 or 6 times every day. Okay, so 30 seconds, not that long. Raphael just gave me the look. That's a long time, but it's not 30, especially if you have shoulder pain and you want to avoid getting steroid injections or anything else. So I hope these exercises were useful. So this is something you can certainly do at home. So for proper diagnosis, you should definitely seek a professional medical care, and you should come to us at Back to Health Physical Therapy, and Max and I can help you with the exercises. I hope this video was helpful and useful, and please like us and share us on Facebook. Have a good night.